Hello, welcome to another episode of Question of the Week. This week's question is, should bronchodilators be given to a trach patient? Kathy Parr. Thank you so much for your question. Bronchodilators should be used if the person's medical condition indicates they would be helpful. For example, if a person has asthma or chronic obstructive pulmonary disease, bronchodilators will help open up the airways and alleviate some of the person's symptoms. When a person becomes sick with a respiratory infection, it is a good idea to give someone with a tracheostomy tube a bronchodilator. Respiratory illness can cause a lot of inflammation, which will narrow a person's airway. This will make it difficult to breathe. Using a bronchodilator will help increase the diameter of the airway and will make it easier to breathe. Since the tracheostomy tube takes up space in the airway, some doctors believe it is a good idea to give bronchodilators to all patients who have a tracheostomy tube. Bronchodilators will dilate the airway. This will make it easier to manage secretions. Talk to your medical provider about using bronchodilators with your tracheostomy tube. In general, bronchodilators will help with medical conditions such as chronic bronchitis, emphysema, and asthma. Additionally, people who have narrowed airways may also benefit from using a bronchodilator, as the medicine will help open up the airway and will make it easier to breathe. Also, bronchodilators will expand the airway and will make it easier to expel mucus from the airway. Thank you so much for your question. And remember, if you have a question, you can leave it in the comments below this video or submit it to me via Facebook, MeWe, or email. Thank you so much for joining me. I hope you have a great day and a wonderful week. Bye-bye! Many doctors have prescribed me bronchodilators. However, the most commonly used bronchodilators cause me to become very ill. I have a medical condition called postural orthostatic tachycardia syndrome. With this condition, my autonomic nervous system becomes overstimulated and causes my heart to beat very quickly. The two most common bronchodilators, called albuterol and levobuterol, activate the receptors on my heart and cause it to beat very fast. It exasperates my postural orthostatic tachycardia syndrome. My resting heart rate will go up to 150 beats per minute. To give you a reference, during a vigorous cardiovascular workout, a person's heart rate is often in the 140s. Using albuterol or levobuterol makes my heart beat faster at rest than doing an extreme workout. This makes me very sick. I cannot get out of bed, as sitting or standing up will make my heart rate go even higher. There is another bronchodilator called ipratropium, which works in a different way and does not activate my postural orthostatic tachycardia syndrome. However, this medicine is difficult to obtain due to insurance stipulations. In general, I do not use bronchodilators because they make me very sick.